Hi, everybody. My name is Christine from Global Education Therapy, and today we are going to cover self-care, or more specifically, a parent guide to self-care. Today, we have our very special guest, Vivian, who is the founder of Expat Nest. Hi, Vivian. Thank you so much for joining us.
Thank you so much for having me. It's such a pleasure, to be part of this community.
Definitely. And we're happy to have you. All right. So before we start, besides Expat Nest, we actually are affiliated with lots of other great partners. So if you're looking for international schools, maybe an online school, maybe just more expat help or psychological services, whether it's eval or behavior help, we have it all. So go ahead and check them out on our website. All right. So what are we covering today? Today, we're going to go over who I am, as well as Vivian. We're going to go over why we need self-care and why it's absolutely essential to just being a human being, as well as a parent, how to do it, because let's be honest, as a parent, there's just so many things to do. So how do we achieve self-care? And then on top of that, Vivian's going to teach us 2 practical exercises to try that we'll show for you. And lastly, we'll go over a discussion of what self-care is and just your questions. So to start off, my name is Christine. I'm an occupational therapist at Global Education Therapy. We recently were the winner of GHB's most inclusive online speech and occupational therapy clinic. So go ahead and check us out. On top of that, I have a master's in occupational therapy sciences from University of Southern California, and I specialize in sensory integration, processing, feeding, self-regulation, and fine motor skills. Besides my work, I'm an expat parent myself in France, as well as a third culture kid as well. So this is going to be, I hope, really helpful for other kiddos, other families who really need this extra help today. And when I'm, once again, not working, I love to cook, I love to travel and jam out to music with my kid, specifically the Beatles and Queen. So Vivian is the founder of Expat Nest, which really promotes online counseling and just well-being and health, mental health wellness for parents, couples, and teens. It provides services for expats in 7 different languages. And on top of that, they are a winner of Best Online Expat Counseling Provider. So definitely a great resource that we are partnered with. On top of that, Vivian is a multilingual bicultural expat with family all over the world. She is Assyrian and Greek descent, and her clinic is actually based in the Netherlands, but regardless of where you live, they are an online service, so they can reach you and you can get the best services from Expat Nest. On top of that, Vivian has also been awarded as 100 most inspirational women in the world in 2020. So, I mean, that's fantastic, Vivian. That's super exciting. And when she's not working or helping people out, she loves traveling and being a foodie. So without further ado, Vivian, please teach us your ways of being an expat, but also giving self-care. We would love to just hear from you and take it away.
Okay, first of all, thanks so much for the wonderful introduction and welcome to everyone who is here with us. It's such a pleasure, as I said earlier, to be part of this community because I know how much you offer to the international community, and I'm very glad that our services are also part of this collaboration. Now, I want to ask our audience, like on a scale from 1 through 10, how are you feeling today? Just take 10 seconds to really tune into your body and notice how you're feeling. Okay, great. How are you feeling, by the way, today?
I think a 7.
7?
A 7.
Okay.
Yeah,
Yes.
good, but just it's Thursday. I'm waiting for the weekend.
Yes, great. So the reason I'm always asking this question is because, first of all emotions are normal, and the simple act of naming our emotions has been found to benefit the well-being, and also accepting our feelings, especially the difficult ones, can also help us build resilience. It's an important step to building resilience. That's why sometimes it seems so simple, but it's so important to start with really the basics. How are we feeling? What's the awareness that we have in our body about it? Now, what really keeps us stuck from making self-care part of our lifestyle? It could be uncertainty, what the future lies in us, or are we going to move? What is going to happen? I don't have time for this. It could be the lack of fulfillment and missing, a sense of direction in your life. So you don't see the importance of self-care if you don't see an important vision for your life or a specific direction. It could be hidden losses. That's an interesting one because expats can experience multiple layers of loss. For example, for expat partners, it could be the loss of career, loss of friends and family back home, the loss of status or the loss of belongings, or the loss of missed opportunities that we could have, but we're not there to experience them with the people we love. This hidden loss means also hidden grief. And when we feel grief, which is, by the way, a thin line between grief and depression in many cases, sometimes we don't have the energy to really focus on self-care. Where, of course, the answer when we're feeling this way is primarily self-care. I'm going to talk about it further. But really, especially if this is the reason that is keeping you stuck, self-care is the answer to begin with. Another reason that I hear in my work is energy and patience are reaching low. We all have busy lives. But for example, with new expats, I hear it all the time. They juggle everything, from starting with the relocation, the planning of it, going through the transition, and then making sure that everybody in the family is well adjusted. And sometimes as parents, we may neglect our own needs because the carer in us takes over. And the last thing is, what's the point? People don't see the point of actually putting self-care as part of the daily routine. And we will see that there is a point and actually can make a huge difference in your life. Now, some signs that you may be struggling: high levels of anxiety, high levels of depression. And it's important to ask how do you hold your stress, how this is manifested in your life. If you have anger management issues, or if you feel more homesick lately, or if you're in denial that everything is fine, but you feel that something is off, but you're in denial that something is off, then this could be also a sign. Again, disturbed eating pattern or sleeping pattern, there could be signs that you may be struggling. And of course, psychosomatic symptoms. That's a tricky one because most people think, oh, I have headaches, muscle pain, stomach pain. But if there's not a physical reason for that, you may explore, this is psychosomatic, because our bodies always express what we cannot express through words. Our bodies will always find a way to express this. So this is important. And if this resonates with you, I would encourage you to take action, because it doesn't have to be this way. And there are so many things we can do to change it. Now, first of all, as we said earlier, what is self-care? Because that's the answer to everything I discussed before with you. Self-care is any deliberate action you take to promote your emotional, physical, and social wellness. It's really about your lifestyle, with the ups and downs of our lives, of course. It's really adopting rituals and trying to create a momentum. As I say to my clients, it's like really like brushing your teeth. You're not going to wake up in the morning and feel a miracle because you just brush your teeth. However, you know that this is good for your health, and that's why we do it. It's something similar with self-care. We have to keep doing it, and then we'll start seeing the results. Because it's intentional, it's challenging, I understand that, but it's also a lifelong pursuit. And this is really about all the good habits that you develop, not only the things you do after a bad day. Of course, it's good if you have some techniques and you use them after a bad day, but let's go to the next level and have it as every day or as often as you can. because it can really be 5 minutes, 10 minutes in your day, but is the foundation for your health, for your mental health, I mean, and physical health as well. Self-care is not a checklist to complete, and it's not another pressure to your day. If it starts feeling like this, we need to change something. And also I want to add that it's not a guilty pleasure. During the pandemic, there was that hashtag, I don't know if you have seen it, not a guilty pleasure, about self-care. And then I started wondering, how have we reached the point of apologizing for taking care of ourselves? That's something for us to reflect. I'm a great believer of self-care because self-care expands into caring on others. The same with self-love. When you love yourself, this expands into loving others. So it's really fundamental. It's not a guilty pleasure. It's not a luxury. It's really something we really need to do for ourselves.
Definitely. And Vivian, if I may just ask, I think saying self-care is not a checklist to complete is so powerful, right? Because one of the things our families always ask is, well, I want to do self-care, but I feel like it's just another added stress to my day. So I was curious if you had any specific or specific examples to share to implement self-care, or maybe just some strategies or something like that.
Right. First of all, you need to decide that you want this to change. The decision is the first step. And you start small. Just do something for 1 minute per day. And then 1 minute will become 2 minutes, etc.
Okay.
We have to start, with the minimum motivation days, minimum efforts. That's okay to begin with. And also, I understand that it may feel like a checklist and you don't feel you have time for it. But we also have to reflect that there are things in life that drain us, and that there are things in life that gives us energy, that after that we can do 20 more things that we would do normally, just because we did something that gives us energy. Imagine going home and, play with your baby. Don't you feel that you have energy then to do more and more tasks, although you are tired?
Yeah, no, that's a really good point.
Energy just because you did something good for you.
Okay.
And for your child, of course, in that
That's a
example.
really good example. Yeah.
So, yeah, try to do the things that give you energy.
Interesting. And I like that you're trying to get people to make it into a habit, right? Like habit forming. So that's funny because in occupational therapy, we recommend that for trying new strategies. So it's funny that there's sort of a Venn diagram meeting there, which I quite like. So
exactly.
thank you,
And
Vivian.
it's really all about the good habits that we develop.
Right.
And, we take it gradually. It doesn't have to happen, overnight. There's no pressure about it, as long as we're working towards this direction.
Great,
And it
great.
will
Thank
get
you.
better with time.
Super helpful.
So, anything else, or shall we move to the next?
I think that's great. That was a really good example. And I like that you really went over a specific example and then kind of implemented it in what you just taught us. So yeah, no, that's perfect.
Yes, and start small. I think that's the main tip with these things, because change is, it's a process. It has a beginning, a middle, and an end. It's always a process.
Definitely.
The main tip I would like also to give to everyone listening to us is that we should put our own oxygen mask first. I know it sounds like a cliche, this flight safety demonstration. However, like the tip that we have, before helping children or anybody else who needs you, but it's so fundamental, because there is no energy, there's nothing we can do and nothing to give.
Right.
If we don't put our own oxygen mask first. As I say, a good parent is also a happy parent, happy with themselves.
Yeah,
absolutely. And that's really the starting point, because children also tune in with our emotions. Now, the golden rule, 50% of the overall stress management is the lifestyle. I'm going to elaborate on all of this later. So 50% is the lifestyle, 25% is setting healthy boundaries on ourselves and on others, and then 25% is how we respond to events. So I'm going to explain a little bit more. The lifestyle is about the basics. physical fitness, nutrition, water, rest breaks, sleeping pattern, social support, and also even what we read online and what you feed yourself mentally. It's everything that will help you have a healthier lifestyle. And even with my clients in therapy, I say to them, we can learn many techniques, but if your lifestyle doesn't support everything we do in therapy, the progress will be slower. But if your lifestyle promotes that, because I'm also a health psychologist and I cannot ignore the importance of that. Really, it starts with that. Sometimes we can see great results in therapy just because someone changed something in their lifestyle. It's really so important. Now, the second one is about setting boundaries. And here the skill is about becoming more assertive. Imagine that we have a line, and here it's the passive on one end, and on the other end is the aggressive. The golden middle is how we can be assertive. I'll give you an example. Let's say you had a fallout with your partner, and you don't say anything, your emotions are bottled up, so you're in the passive mode. Then something minor happens or something big happens the next day, and then you have an outburst. And then you feel guilty that you went into the aggressive mode and you go back to the passive mode. Oh, I shouldn't have said that. Now it's better not to say anything. But this creates a vicious cycle. And the solution to that is learning to become assertive, which is to express your thoughts and your feelings without blaming the other person, but expressing what you need. It's a big theory about it, but I'll try to put it in a nutshell. I feel this way, and you just focus on how you feel, not how the other person made you feel, but how you feel. Because, and you mention one or two facts, and then what I need or expect from you is, and be very specific on this. The third part of this sentence is the most important. What do you expect from the other person to do? One thing. So I feel this way because, and what I need from you is. Less than a minute, think it in your mind, and just be brief.
And I love that you gave us a sentence structure for that. Thank you. I will be practicing that with my own husband.
And you can practice this, in your relationship, at work, with your children, your parenting. It goes everywhere. It's one of the basic skills I think we do learn in therapy.
Super helpful.
Great. Now, next one. It's about how we respond to events. And remember, what you're telling to yourself about yourself and about the situation is the most important thing. What I mean by that is, what you're telling to yourself affects how you think, and how you think affects how you feel, and how you feel affects what you do, and what you do has consequences. I'll give you an example. Let's say if you had a bad day as a parent, and you tell to yourself, oh, I'm a bad parent, then you feel sad, and most likely you don't have the same energy, let's say, to do the things you wanted to do with your children. And this has consequences, which in turn affect what you're telling to yourself about your parenting role. Whereas if you wake up in the morning and you say, okay, yesterday I had a bad day, today's another day, I'm a good parent, I know that. This will affect how you feel and different actions, and it will lead you to different consequences. So everything is about how you respond to events, and you choose how to respond to events.
Definitely. And that's such a good example. Sorry to interrupt, but that's such a good example, because I know as a parent, I have definitely said that to myself, right? I think it's so relatable. I think we have our own expectations of who we're supposed to be, but I think what I love about this is that you're telling us that we do have some control on our perspectives of, and that perspective impacts how we feel, how we think, and how we're going to take on the day. So that is really helpful. Thank you, Vivian.
Great. Happy to hear this. Now, the next one, that's my favorite part when it comes to self-care, because it's so practical, it's easy. And if there's one thing you will take away, I would try to pay attention to this one. It's about the 4 hormones of happiness. We all have them, and we all produce them naturally. If we don't, then usually we have, people take medication or something. Like, we really need these happy chemicals, as we call them. And what I would like you to do every single day is simply 4 things. I would like you to take 10 minutes of physical exercise per day. If this is too much for you, for whatever reason, just break it down. 10 minutes of walking, 10 minutes of, putting your favorite song and dance, 10 minutes walking up and down the stairs. That's it. If of course you're able to. But because there are good days, bad days. So try to break it down if this sounds too much for you. It's important to adjust it to the level of your capacity and, start small, as we said earlier, and you can always build up. Because that produces more serotonin, which is the mood stabilizer. Mm. The next one is if you can have 5 minutes of relaxation techniques or prayer, if you believe in a higher being or to God, or it could be breathing techniques, meditation, anything that for 5-10 minutes per day will give you more endorphins. Because this really help us release anxiety and reduce anxiety. Now the next one is oxytocin. Of course, when you're a parent, this comes easily because you hug your children or you hug your partner if you have one. And oxytocin is really the love or the hug hormone. And we can also produce that by giving gifts to someone. Or, by just physical touch in terms of having a massage or, anything like hugging, kissing, all of these things. And the last one is the dopamine. It's called the reward chemical. And I would encourage you to do one thing per day that gives you a sense of accomplishment. It can be a tiny thing. For example, during the pandemic, I was encouraging some of my clients, not to be in their pajamas the whole day. For the pandemic time, this was a huge accomplishment because you were at home all day and it would be easier just to be in your pajamas the whole day. But then we needed to change, to shift the focus and lift the mood. So for that, it was a reward for them to do it. But the moment you do something that your brain perceives as accomplishment, it produces more dopamine. And this means more motivation to do more things. Our brain is wise, and we can really trick our brain with these little things. So this is the 4 things I would encourage you to take away. And you see, it's just 30 minutes of physical exercise, 1 thing per day that gives you a sense of accomplishment, 5 minutes of relaxation techniques, and just a hug or something similar, as I said before. In total, 40 minutes, 35 minutes. Yeah. How does it sound to you, Christine?
Yeah, definitely. No, it's good because I like that you're giving us these scientific terms and giving us information about how our brain works, but then you're breaking it down in really realistic and achievable little goals, essentially, or just activities. I actually do have a question though. I feel like serotonin, oxytocin, endorphins, those are things I've heard before, and I feel like those are tasks I do regularly. But I think for dopamine, the reward chemical, I think we take it for granted that every little thing we do is an accomplishment. So how do we change our perspective on that? Or how do we embed more of those activities? Because I think that's what I struggle in, or at least as a parent, I feel like, oh, I haven't done anything today because I've been running after my toddler.
Right. And you have done 100 things if you just write them down, what you do, what you have done in the day. But yes, it's a matter of perspective. And what I say sometimes to my clients is make a list of at least 3 things that are important to you, that you need to do it, and the rest is a bonus. So most people start seeing, the sense of accomplishment after the 3 basic things that they have to do. So in a way, you train your brain to see it like that. Or we train our brain by practicing gratitude, for example, by counting the blessings or what you're grateful for. And then maybe in that way, you also count your achievements or all the things that you're happy with in your life. So what matters, as I said earlier, if you put a tiny goal, as with the pajamas, for example, as I said in the pandemic, then when you do it, it's not that your life is changing, but you have put it as a goal to achieve. Okay. So you can make it as big or as small as you want in order to have that feeling of accomplishment.
Definitely. Yeah. And that's
If you want to take, let's say, your child to the park, this is something that you have put as a goal for the day. Or if you take her, let's say, every day to the park, but then you say, okay, but today I'm going to stay for 10 minutes longer. You put another goal, and then you feel a sense of accomplishment because you did that.
Yeah, that's a good example and very doable.
Right. And by the way, even if you start practicing one of the examples that I've used on this slide, anyway, you're going to start having more dopamine because you're doing something towards this direction.
Definitely.
One brings the other, and that's how we create momentum.
Right. Yeah. No, that's really helpful. Thank you so much.
Great. Then I just would like to show you a brief breathing technique. I call it the 20. It's a very easy one. I even use it with clients with panic attacks because it's so easy. You can do it everywhere with your eyes open or closed. If you want to have your eyes open, you just focus on a specific point and you just do it. Pretty much what you have to do is to count up to 20 and then you count down. The reason this technique is effective is because your brain cannot think of what is stressing you, breathe, and count down at the same time. So the counting down is really the most important part of the exercise because this is where the relaxation starts. And I would encourage you to start by first breathing out all the tension. By breathing out, we relax more, and then you breathe in calm and peace, and then you start counting up to 20, and then counting down. If you practice this, let's say for a week, when you use this technique again in the future, your body has wisdom and memory, and it will remember, oh, I do this when I'm calm, and it will reduce the anxiety levels. And of course, then we have the benefits of the breathing per se. So it's very easy. That's why it's so effective, I think, because it's so simple and we can do it anywhere.
Anywhere. Yeah.
Now, and there is another one, which is called the safe place. Would you like to practice with me, Christine?
Sure. Why not?
Let's do it together. What we're going to do is we're going to find the safe place that we have in us. You can think the answers in your head. You don't have to share it with everyone, of course, because it's a self-guided imagination technique. So please close your eyes. I want you to take a deep breath out, all the tension of your day. And I want you to breathe in calm and peace. And again, you breathe out all the tension. And you breathe in calm and peace. Now I want your imagination to take you outside of this room. And I want you to travel to your safe place. This is a place you've been or a place that you would like to go. This is where you feel calm, happy, and relaxed. What is this place?
Oh, am I responding?
You're thinking that questions in your head.
Okay, just want to make sure. I got too relaxed. Sorry.
I'm just all right. How does it look? Are you alone or somebody else is with you? What are you hearing? What are you seeing? What are you touching? What are you smelling? What time of the day is it? You think the answer is in your head. And for the next 30 seconds, I want you to feel with all the senses of your body, the safety and the calm of this place, which is only yours. Nobody can take it from you. And whenever you're ready, you may gently open your eyes. How was it? Obviously, in a therapeutic session, we would take a bit longer to do it, but how did you feel?
Oh, it was definitely really nice. I got to visit that beach that I've never been to, but I want to go to. So thank you for that.
Great.
Definitely needed that for the end of the week.
Right. And the concept of finding a safe place or a sacred place is so important for expats because the concept of home is shifting so often when we move to another country, etc. So it's always important to know that we have a safe place in our hearts.
Right, definitely. Or a place you can always retreat to when things get stressful or, too much or overwhelming. That's
Exactly.
it's
And
a great
again, an
strategy.
exercise that you can do anywhere. You
Mhm.
just close your eyes or you have it open and you go to your safe place.
Nice. I like that. It's a great, thank you for doing that with us.
And thank you for inviting me here. This was my presentation, but I'm happy to answer any of your questions or if the audience wants to ask something.
Definitely. What we're going to do now is just kind of go over a few questions that you guys have asked us. However, I feel like Vivian did such a good job going over my questions and everything that we had. So what we'll do is just a very quick review of what we've done. But what we're going to do is just kind of go over the questions and then we're going to just have a nice discussion. So I think we've already talked a little bit about making self-care not a checklist. So I think that one we can, funnily enough, check that off the list, but we have some others. So some others are a lot about being an expat parent, moving back and forth. Do I really need a village? And is it really bad I don't have self-care? So, Vivian, which one would you like to start with? Would you like to start with what most of our families ask, who are part of the foreign service or military, who are like, well, what's the point of this self-care if it's just for this temporary time? And I'm just going to move back home anyway, where I have family and friends. What advice do you have for them?
Right. Yeah, it's not something contextual. Self-care is something we need to really adopt the rituals in our daily routine if we want to make a difference in our lives. Of course, it's easier when you have family support or friends around you. But it's really going to the next level. You don't do it because you feel lonely or because you are an expat. You do it because you're a human being that needs to put you need to put yourself as a priority to be healthy in order, to be a good parent, a good partner, a good friend, etc.
Right, so you have energy for yourself so you can give it to other people. I really liked the oxygen mask thing. I know it's quote unquote cliche, but I do tell myself that often. And so with that same vein, for those who don't have a village or like want to have a bigger village, but they have a small village, but maybe language is an issue and things like that. What do you think about that question that our families ask us?
What do you mean about language? Like as a child
So,
or
so for example,
adjusting?
for me, I have a couple friends out here for my son and myself, but French is not my first language. So it's harder for me to make those friends. It's harder for me to get out there. And I feel like I get more inward because I'm like, oh, the language, do you have any ideas or
Right,
advice
right,
for me?
right. Meaning that because we said earlier that social support could be part of the self-care, connecting with others, etc. It can be a challenge when language is an obstacle in these cases. But of course, you can also connect online with your family or friends back home, or also you can join international groups that perhaps you can find, a more common experience or a common language to talk. And for expats, I always say to them, if you're going to spend some time in the country, it's always good to start practicing and learning the
Yes.
language. It will make you feel more familiar with the culture. It can help you make more friends. Yeah, if you have the time, I would strongly encourage you to try it.
Definitely. And there are lots of really good online language services. I used one for a while called Lingota. That was good. And it was social. It was like in Zoom. So that's
Right.
something I recommend as well. So yeah, no, that's very, very helpful.
Yes,
Oh,
and
sorry.
just want to add something. If someone says, but oh, I don't have the time for all of these things,
Yes.
that's okay. Sometimes taking a pause or having a break
Mhm.
is also part of self-care.
Ah, okay. I like that. Can you give more examples of
self-care is
how
not
to do
just,
that.
self-care is not just going for a manicure or pedicure
Right.
or doing things for ourselves that we think we enjoy. It could also sometimes be self-reflection. It could be taking a
Mm,
break when you need it. It could
okay.
be, I'm going to be half day off social media, for example,
That's a good one.
connecting with myself. So if someone feels that, okay, I have too much or I have self-help exhaustion, because I hear people really having self-help exhaustion, you can take a break. That's fine. That's also part of the self-care.
Right, definitely. And that I feel kind of works with the other big question of the checklist. Like it's easy, it's actually not too hard to be like, hey, I need 5 minutes to myself or 5 minutes for a coffee by myself.
Yeah.
That's very achievable. Definitely. And that's something I've written a lot of notes, Vivian. So thank you for all these helpful strategies and tools. I think the next one and our other question that families ask, or they're like, well, it doesn't fit in my schedule. Do I really need that self-care? Is it bad I don't have self-care? I think that's something we get asked a lot. So I was curious what your input would be.
Yeah, I wouldn't like, to put a label good or bad,
Mhm.
etc. As I said in my presentation, I think it's fundamental
Yeah.
for our health. And I hope that in a way I covered the answer to this question so people find
Yeah.
the why is important to do it. Once you have a clear why, then you have the necessary fuel to change, to make the change you want and to do things that are important for your self-care. So it's not really about good or bad, it's about, do I put myself as a priority, my
Yeah.
health as a priority? And if you say yes, then ask yourself why this is important for me.
Mm.
Because, for example, I'm going to have I'm going to live longer years, or I'm going to have better relationship with my family, or I'm going to have less costs for healthcare costs, whatever. The reasons are why, but try to write down at least 15 reasons why this is important to you.
Mm.
Once you know why, then it will be easier to put it into actions and trying to think, okay, I know why I'm going to do it. I'm going to start small. I'm going to just do one thing per day that will help me towards this goal.
Definitely, definitely. That's very helpful because I think for me, when I think of self-care, I think of like a big bath or getting my nails done or spa day, which are really big goals that you can't really fit. Whereas I like the idea of breathing, looking at, small things to achieve, little exercises, implementing it in your daily life. So that is definitely doable,
Yeah.
right? And everything. Great. Well, Vivian, thank you so much for your time. It's obvious you've had 10 plus years of working with families and expats. So thank you for giving us your nugget of wisdom. Once again, I want to thank everyone for joining us today. Vivian of Expat Nest is on our website. So if you want to check her out, please do. I believe you have a link to you have free consults, right? That they can just click. Definitely. And same with us as well for your special needs education and whatnot with a global education therapy. Once
Right.
again,
And if they
thank you.
wish, they can also join our newsletter. We have free resources for internationals, and then they can do it through our website.
Perfect. Perfect. Well, once again, thank you so much. I'm going to start doing those mindful of breathing exercises and have a great day.
Thank you. Take care. Bye.
Bye.